Hello friends, myself Kishore, and I think you are very much acquainted with me, and I already have told so many things regarding about myself in my previous videos, so I'm not going to repeat all those things once again. So I have decided to start a new series of videos on anatomy and physiology first before I prepare pharmacology videos, because if a student is unable to understand the anatomy, physiology, and the biology portion, then he will not be able to understand the mode of action of any drug. And also anatomy and physiology and other sections of biology like biochemistry and all are related to pharmacology. So to understand pharmacology, it is a very important part, anatomy and physiology. First, I am starting the videos on anatomy, and I will take help of few renowned books, world-class books, and I will tell you the names of the books also. If in your library or any other sources, if you can get those books, then you can take the knowledge from that book itself, but I will try myself to make those books easier by my videos. Okay, and another thing is, I believe that the learning, which is much more audio-visual, is very much easier for everybody. So today's video, which introductory video, and I'm going to make it very simple and small. If it is good to understand, please make your comments in the comment box, and if there is any improvement required, then please let me notified. So this is Anatomy Made Easy. I have given a name to this particular series, and the name is Anatomy Made Easy for you. Okay, a visual approach, because I will just tell you all those things on the basis of the visuals, which is drawn by Dr. Netter and another renowned doctor. And this particular session or this particular videos which I am going to upload, that is based on Netter's clinical anatomy. First, we have to understand the terminologies which used to be followed in anatomy study. So there is a clinical vocabulary. If you don't know the clinical vocabulary, then it will be very much hard to you to understand the anatomical study or anatomical any further discussions and all. This is the first picture, and we can see here from the left side we are going to start here. In our forehead section, we can see this is called the temporal. Beside the forehead section here, in this portion is called temporal region. Okay, now next, the orbit where the eyeball is situated, that is called orbit, and that is the region is called orbital. So many terms will come in anatomy where these terms will be used, like temporal lobe inside the brain. So where is the temporal region? We have to know that. Then it will be much easier to remember. Okay, inside the brain, inside the cranium, here there is temporal lobe. So the region is named temporal, hence the part of the brain, the portion of the brain is called temporal lobe, a lobe of the brain. There are 5 lobes inside the brain, like frontal, parietal, occipital, temporal, and limbic system inside. After that, orbital or orbital. That means where our eyeball is situated, there it is called orbital. Now we know everybody that mouth region is called oral. Mental means this region is called mental. In this region, it is called sternocleidomastoid. Sternocleidomastoid. This region, here the side portion of the neck is called sternocleidomastoid. Next comes the muscle portion. We know this particular muscle is called deltoid. After that, here chest portion, just above the breast for female, that is called pectoral region. pectoral. And after that, mammary. Mammary means, everybody know, the breast portion. In biological term or medical term, we used to say mammary gland, like that. After that, here we see that anterior brachial portion. Many of us have heard the term brachial artery. So this portion is anterior brachial. What is anterior? That we are coming next in the next slide. Anterior means frontal portion. Okay, front portion, front. Now anterior brachial means this particular region. Okay. Now next comes inframammary. Wherever this particular prefix is used, infra. Okay, infra means just below the mammary gland. So inframammary, this region is called inframammary. This one, this portion is called inframammary. Okay. Now next comes cubital. Here, this region is called cubital. Now next comes anterior antebrachial. Anterior antebrachial. Now why anterior? Because this is the front portion. Now antebrachial means front of the brachial portion. Okay. Here another one artery is there from here to here, that is called brachial artery. Okay. So anterior antebrachial. Now next, this whole region is called anterior antebrachial region. Okay. Now here the posterior antebrachial means behind this hand, means behind the hand portion is called posterior antebrachial, and front portion is called anterior antebrachial. Okay. Now comes umbilical. Umbilical means this is the navel portion. So umbilical region means this whole region beside all the navel, or periumbilical means beside all this. Umbilical means umbilical cord. We know umbilical cord is a cord which used to be there when we are in our mother's womb, and we have taken nutritions from placenta, from mother, during our embryo stage. So from there this particular term came. Umbilical means the navel portion. So this region is called umbilical. Now next comes anterior femoral. Here one bone is there which is called femur. We know the longest bone of our body. So from there this name came, that anterior femoral. Anterior means frontal or front, and femoral means this region is called anterior femoral. Femoral means femur, from the femur this particular name came. Now next came anterior region of the leg, means the frontal portion of the leg, this portion. Now here comes heel. Now this particular groin area means the region of genitalia, where it is below the abdomen, that is called perineal. Perineal. P-E-R-I-N-E-A-L. Perineal. Now the right side we see. First comes frontal lobe. We know that behind this particular bone there is frontal lobe in our brain. So it is called the forehead portion, frontal. Now the nose region. For the nose, the term nasal comes. Okay. Anterior cervical. This particular portion, where in case of males, here Adam's apple is there, we know, the voice box. This particular portion is called anterior cervical. Now this cervical term came from the a particular bony structure, that is the vertebral column. From there, the lateral cervical. Next, here this portion is lateral cervical, means side portion of the cervical bone. Now infraclavicular fossa. Infraclavicular fossa. Fossa means a depression. Wherever in the biology or anatomy fossa term is there, means a depression. Infra clavicular. This particular bone is called clavicle, okay, collarbone. So infraclavicular means just below the clavicle. This region is called infraclavicular fossa. Now subclavian, here just above the plane, above the region of here we see that pectoral region, pectoralis major, one muscle also is there. From there, this name, from this particular terminology, that muscle name used to come, pectoralis major, pectoralis minor, like that. So just above the pectoral region, this region is called subclavian. We know that there is an artery which is called subclavian artery. So from this terminology, the name came. Now next, here just below this region or behind this region, one very strong bone is there. We know that bone is called sternum. So this particular region is called presternal, means before the sternum. Okay. Now axillary, axilla, you know which region is called axilla? That is the fold where our hand folds, arm folds, not hand, where our arm folds, armpit. That is in medical term or anatomical term called axillary. Here posterior brachial, this particular region is called posterior brachial. Their anterior brachial we have seen in the left side. Now this is called posterior brachial. Okay. Now this portion, lateral thoracic. Thorax means the chest portion or the main body portion, which is called thorax. This portion is called thorax. Okay. So lateral thoracic, this particular region is said. Lateral means side portion. Okay. Side portion of the thorax, lateral thoracic. Now anterior region of elbow. Everybody know what is elbow. So this is the front portion of the elbow. Now here in this particular region is called hypochondriac. Okay, hypochondriac. And this portion is called epigastric. Epi means upper portion, and gastric region, we know that here behind this particular region there is our stomach. Okay, so from that name, from that particular view, this particular portion is called epigastric. Now this is our palm, so this is palmar. Here this region is called lumbar. Lumbar, here in the vertebral column there are few bones which is called lumbar on the basis of this region. So lumbar means our belly portion. Okay, so lumbar. After that, inguinal, this portion is called inguinal. Inguinal hernia means hernia in this particular region. Okay, so after that, this area is called trochanteric. Okay, here in this region or abdomen region, hypogastric. This is epigastric, this is hypogastric. So this total belly portion you see, first epigastric, then umbilical, then hypogastric. In these three parts it is divided, and this portion is inguinal, and here this portion is lumbar. So in this belly portion, this all segments are there. First is epigastric, the frontal portion, first part epigastric, after that umbilical portion. Now next is hypogastric. Okay, the side portion here, this is called hypochondriac. Right side means left side hypochondriac, right side hypochondriac region. This is left side lumbar region, this is right side lumbar region. This is left side inguinal region, this is right side inguinal region. Okay, now next comes medial thigh. We know that this is thigh, this portion. So this is called the medial thigh portion. Okay. Now next comes the anterior region of the knee. Already we have seen this particular region, which is called anterior femoral. Here also, as our body is symmetric, so here also this region will be called anterior femoral, and this is the anterior region of the knee, where patella is there below the skin. After that, posterior region of the leg, this one, and dorsal region of the foot, this portion. Now what is anterior dorsal? We are coming in the next slide. Now see the back portion of our body. What are the terms or terminologies there? So first comes parietal. Parietal, this region, I already have told that on the basis of the bone of cranium, there are lobes in our brain also. Below this particular bone, the lobe is called parietal lobe. Okay. And behind this particular region or particular cranial bone, the lobe is called occipital lobe, like that. So parietal and occipital. Now this portion already I have told that temporal. Okay. Posterior cervical. Posterior cervical means this particular region, which we used to generally call neck region, back of the neck. Okay. Now sternocleidomastoid, here, just below the temporal lobe, just behind the ears, little region is called sternocleidomastoid. And here in this particular picture also we have seen that here in the frontal neck portion also a portion is there, sternocleidomastoid. Now this region is called suprascapular. What is the scapula? Scapula is a bone. Here it is situated, a triangular bone. So above the scapula, a scapula is a bone like this. It is situated here, just here, above the scapula. So it is called suprascapular. Now infrascapular, see, just below the scapula, this region is there. So it is called infrascapular. Posterior brachial. Posterior brachial already I have told. So again I am not saying this region, posterior brachial. Hypochondriac region, already I have told before. Posterior of the elbow. Elbow means this portion we know everybody. So this is the posterior part of the elbow. Here, this region is vertebral. We know that below the skin there is vertebral column here, as we are vertebrates. So this region is called vertebral. Okay. Now next comes dorsum of the hand, means upper part of the hand is called dorsum of the hand. Okay. And the other side is called palmar. This portion is called gluteal. The hip portion is called gluteal in anatomical term, because this particular muscle is called gluteus maximus, the biggest muscle of our body. So this portion is called gluteal. In the both side we can see this. Now this is posterior femoral region. We know that the longest bone of our body is situated here, and just backside of that bone it is situated, these muscles. So this region, so it is called posterior femoral portion. Posterior femoral. Next comes posterior of the knee. We know that at the anterior portion there is knee. So this is the posterior portion of the knee, or back portion of the knee. Now there is the dorsum of the foot. Here we can see this. Dorsum means the upper part of the foot. And here this is temporal, already I have told. Interscapular means in between two scapula. Here also another scapula is there. So this region is called interscapular region. Here actually scapula will be like this. So this region is called interscapular space, or interscapular, in between the scapula. After that, this muscle is called deltoid, we know. So it is called deltoid. This is scapular region, just above the scapula, the triangular bone. After that, This side region is called lateral portion of pectoral, lateral pectoral. Okay, posterior brachial already I have told. This region, the posterior part of the lumbar region. Okay, now this is the posterior part of the antebrachial region. This is called sacral. Here we know that in the vertebral column also the sacral region is there. This is the sacral region. This is here, anus is there, so anal. Popliteal fossa. Fossa means depression. Here we know that this region is a little bit dipped, so this is popliteal fossa. Okay, this is the posterior part of the leg. We know this, the back side of the leg. And calcaneal, the heel area. Okay, calcaneal. So here you can take a screenshot of this particular page at the beginning and you can just remember accordingly. Now next slide we are going. Now in the next slide we see that the picture is showing the body planes and terms of anatomical relationship. Okay, at the first picture we can see here that if the body is divided in two sections or segments, that is one superior section and another inferior section, or upper portion and lower portion, this plane is dividing the body into other two separate parts, that is one upper and one lower. That plane will be called transverse plane. And if the body is divided into one anterior or front portion and posterior portion, then it will be called as coronal plane. Okay, frontal or coronal means divide body in anterior and posterior, that may be equal or unequal part. Okay, so coronal plane means the plane which divides or cuts our body into equal or unequal part of anterior and posterior portion. Now anterior means we know that the frontal area, anterior or ventral, another term is ventral. Anterior means the frontal portion and posterior means the back portion. Okay, so this portion is posterior and this is anterior. Okay, now what is sagittal plane? Sagittal plane means if we cut the whole body in two symmetrical segments, just our body is a symmetrical body, so if we cut it like this in a symmetrical right side and left side like this, then that particular plane is called sagittal plane. Okay, mid sagittal also it is called. Okay, or median plane also we can say. So any part of the body if cut in like this plane, then that cut also will be called that transverse section or sagittal section, like sagittal section of the brain, transverse section of the brain, coronal section of the brain, like this. The upper portion is called superior and the lower portion is called inferior. Like this, we will see these terms in case of heart: the superior vena cava, the superior vena cava, the inferior vena cava. Okay, now this portion is called cranial. The upper portion is called also cranial, the lower portion is called caudal. Cranial nerve, we know that cranial nerves, these terms used to come. Medial portion, the mid portion, and lateral portion means side portion. Okay, medial, lateral. Now proximal, what is the meaning of proximal? Proximal means something is our point of discussion from there which is in nearer, that is proximal convoluted tubule, suppose. So if we think that there is Bowman capsule like this in the nephron and the total form is called malpighian corpuscle, and like this convoluted tubules are there, and the first portion is called PCT, or proximal convoluted tubule. That means nearer to the malpighian corpuscle. This portion is in proximity or nearer or in vicinity, so it is proximal convoluted tubule. So proximal means, suppose this is our body, nearer to body this portion is proximal, and our palm is far from our body, so it is called distal. Here also terms comes in the nephron. We know that proximal convoluted tubule, okay, after that Henle loop used to come, then distal convoluted tubule used to come, DCT. So these terminologies will come. Proximal means nearer to the center of discussion or center of the subject, and distal means far from the subject or center of discussion. Now this is proximal region to our thorax. Okay, this is our thorax or body part. So nearer to body means proximal. Our feet is far from the thorax, so it is called distal. So these are the body planes and the terms of anatomical relationship. Next slide shows us the movements, terms of movements, which kind of movements we used to do. Okay, see, if we stand like this and make our hand here like this, here in this type of movement, it is called abduction. That is, we are making our hand to go far from our thorax or central plane, central line. So that is abduction. If we are taking our hand nearer to the central line, this is central line suppose, then this is called adduction. Okay, for hand this is, for leg this one, abduction and adduction. Now if we rotate our hand from this side to this side, so this is lateral rotation. If we rotate our hand this side to this side, that is medial rotation. If we rotate our leg from this side to this side, this is called lateral rotation. If we rotate our leg from this side to this side, it's called medial rotation. That means if clockwise, that is lateral. If anti-clockwise, then that is medial rotation. Okay, here you see, this is the central line, and from the central line, if we stand like this in side position and keep our hand from here to here, then that is called flexion. And keep our hand from here, from central line to here, that is called extension. Okay, in case of legs also the same, flexion and extension. Okay, now if we just move our shoulder from down to up, then it will be elevation. If we move our shoulder from up to down, then that is depression. If we move our body back side, that is extension, and at the front side, that is flexion. Okay, now from the elbow, if we just fold our hand at the frontal portion, that is flexion, and if we make it to its previous position without making it folded, then it is extension. In case of palm also, we can move the palm in extension, like this movement also can do, and flexion also can do if we make our palm downward. If we make our hand shake like this, the upper portion of our hand we are showing means pronation. If the palm portion we are showing, that is supination. Protrusion. Protruded means if something is coming out of from a particular line or particular region. Suppose here one line is there, central line. From here our mandible portion is coming at the front, means pronation. And if it is going back, then retuition. Okay. In case of leg, I already have told this is flexion, this is extension. You already have understood this. Now see, we can rotate our leg also from this side or this side, that is circumduction. Our heel means from heel or feet. We can make inversion or eversion. Inversion means at the nearer to the central line, and eversion means just flat, far from the central line. Okay. Dorsiflexion. If we keep our leg like this from here, then that is dorsiflexion, dorsal and flexion, making this particular term dorsiflexion. And if we keep our leg like this, plantar flexion, plantar. Okay. So these are the terms of movement. You can save the screenshot also for this, because these terminologies, if you just visualize, then it will be remembered. And if you do yourself, you can do during reading or during study. So these terminologies will be remembered, and it will be easier to understand when you go through any study, anatomical study or book, when regarding the movements of body parts. Okay, so just summarize few terms here. Anterior or ventral means near the front. Posterior or dorsal means near the back. Superior or cranial means upward or near the head. Inferior or caudal means downward or near the feet. Near the front, near the back. Okay. Now medial means toward the midline or medial plane. Towards the midline or medial plane. That is medial. Lateral means farther from the midline or medial plane. That is lateral. Lateral. Near the reference point is proximal. Suppose this is the reference point and this portion is proximal. And distal means far from the reference point. This is distal. This is proximal. Superficial means the surface. Superficial, closer to the surface. Deep means inside. Suppose something here. This is the deep portion. Farther from the surface. Medial plane means which plane divides our body into two equal right and left parts. Already we have seen that. Mid-sagittal plane, same, median plane. Sagittal plane divides body into equal right and left parts. That is sagittal. Okay. Frontal or coronal divides body into equal or unequal anterior and posterior parts. I already have shown in the figure. Now transverse means divides body into equal or unequal superior and inferior parts, cross sections. So friends, these were the terminologies. I'm just taking the pictures from Netter's Clinical Anatomy to show you all those things. And this is a very good book. If you go through my videos, small videos I will make, and if you go through and if you take screenshot also, you can take, or if you want to repeat the videos, you can see the videos repeatedly. But please make me encouraged just subscribing my channel and hitting the like button and also the bell icon, and it will make me much more enthusiastic regarding sharing the knowledge among you all. So today's video is, I'm closing here. The next day, a next video of anatomy I will upload. Thank you very much. Visit again to my channel.